There we are.
There we are. All right.
Share it here, and then people will get notified, and we'll get. There it is, right there.
Look at us. We're getting better at this. It only took like 17 sessions. All right, we see people popping in. We wanted to get this going a little bit early so we could give people a chance to log on and also give us a chance to share it to the county webpage. So we'll give it just a bit before we start.
Turn you down.
So we're
Keeping you in stereo.
paper. That's right. Welcome. If you tuned in to see the latest reruns of Tiger King, you're on the wrong page. But if you look for some good COVID information, you're in the right place. How's it going over there?
Good. I just closed it out. There we go.
Yeah?
Everyone is
All right.
saying hello.
Hello, everybody.
I learned from watching the last video that I can't shake my leg because I sat here like this the entire time and not lean forward and squint at the thing. Look at it here because.
Okay, we'll look at it here.
Yeah.
Oh, I did. Yeah, that was a thing. Yeah, so we'll not do this thing.
Yeah. What are they saying?
But we'll do this thing.
Yeah.
Okay. Alrighty. Should we go ahead and get started?
How many do we have?
We have 40 or so people watching.
Do we?
All right.
Okay.
Well, John Boss is here, so we might as well start.
We may as well. Party's here.
Yep. All right. Okay, you guys. Welcome. Again, we'll start like we do every time. Just in case you stumbled upon this video, we're sorry but if you were expecting something else. But no, we are. Well, I am. Now we're just turning into one person. We are collectively.
We're the health department.
We're the health department. So I'm Jen Bacani McKinney, and I'm the county health officer.
I'm Destiny Wheeler, and I'm the health department administrator.
All righty. Whew, that's the roughest part of the whole thing. The rest we just make up. So, okay, so we are just going to start off like we always do. We're going to watch for questions throughout the whole thing. We're probably going to say hi to people and thanks, Mrs. Baker. We're going to say hi to people along the way. We're going to take your questions. We're going to answer questions that have come up throughout the week since last time, and just try to address whatever questions people have. And do it in a really, really smart yet somewhat entertaining way.
Yep, really smart.
But very smart. Like we got smarter since last week.
Yeah.
We can feel it. Look at us.
So we'll start out with the numbers. In case you haven't seen them yet, today in the state there are 1,426 cases of COVID-19 confirmed over 62 counties, and we are at 69 deaths from that, and still no positive cases in Wilson County, so you guys' social distancing is definitely working. And
all right.
Yeah.
That's great. I think one of the biggest messages that we want to share with everybody today, we've seen the comments, we've seen the posts. We pay attention to social media a lot because we know that there are a lot of people with fears and uncertainty. We have fears and uncertainty. I mean, we're not going to lie, the whole world does. So we want to keep an eye on what's going on, keep our finger on the pulse of the community, and see what people are thinking. So we do see posts out there and questions about: are we doing too much? Is this overkill? Is it hurting the economy? Is it hurting people? So we hear you. We know that this is such a hard time for people. We know financially it's hard for people. We know physically it's hard for people. We know mentally it's hard for people. People are staying home, and we're all getting a little bit antsy. But what we do want to say is that, and you've probably heard us say this before, but I think our biggest message is if we do what we're supposed to do in public health and to protect the community, if we do what we're supposed to do, nobody will notice. I mean, that's the biggest thing. So if we do what we're supposed to do and everything works effectively, then lives will be saved, less people will get illnesses, and we will go on about our business, and people will say, man, those guys really overreacted. We did all of this stuff, and look at us now. It wasn't as bad as we thought. And we are okay with that. We feel great. If someone at the end of this says, you guys totally overreacted, cool, then it means we did our job, because that's what we know will help throughout this whole thing, is that we want to do the things that make things never happen, things that we never knew could happen, they never happen, and that's a success for us.
Yeah, and honestly, in any public health initiative, that's if public health works, nothing happens, and that's what we really want. And our efforts are working, and they're working in Kansas. We've been asked a lot about recovery numbers, and even though we're not getting those from the state, I reached out to some of my partners, since we don't have any. I reached out to some of my regional partners and just kind of got the numbers from them, how many of their cases they've had and how many have recovered. And so in southeast Kansas, this is over an 8-county area, there have been 48 cases and 24 have recovered. So we're down to half of what we are. And if you look at the data, there are less than 5 cases in most counties. Bigger ones have some more, and there are some outbreaks in facilities that push those numbers up. But for the most part, it's one case and that person recovers, and then it's another case, which shows us that people aren't just out spreading it in the community. They're doing what they're supposed to do. They're staying home. They may accidentally get it if they go to a doctor's appointment, or if they go to Walmart, or I mean, there are still ways to get it, but for the most part, everyone really, it seems, are doing what they're supposed to be doing. Our daily numbers aren't necessarily going up. They're kind of zigzagging.
We have daily numbers.
Yeah,
Destiny showed me how to find it on the website. The website is really amazing. There's good information.
There's a lot of information on KDHE's website now,
and anybody can access it. So we just know to look at it every day. But go to kdheks.gov, and then you'll see the little spot where it says COVID resources. Click on that and just explore. There's a lot of numbers. There's a lot of graphs, and you can see where things are broken down by gender and age and race at this point. One thing that we were talking about before this is that there is a distinct, higher number of minorities who are infected with the disease and are hospitalized, I believe, too, right? Or is it just with the infection?
Minorities they have a higher infection rate.
Infection rate, not the hospitalization.
So most of the cases in Kansas are white, but the number per, I wrote it down because I thought it was very interesting. 109 out of every 100,000 African Americans statistically has been infected, and only 31 out of every 100,000 whites has been infected. So the ratio is much different, and African Americans are dying at 10 times the rate of white people in Kansas right now from COVID-19.
And so it's a very important statistic, because we know that not only are our most vulnerable people, as we originally thought and said, our older people are people with chronic diseases, immune compromise, but also our most vulnerable people are people who don't have access to care, or don't have the means to go to a doctor's visit, or maybe hadn't before. We say that in that we are actually, we're treating everybody. If you don't have insurance, if you don't have a doctor, still call us, come see us, we're still going to take care of you. So, but that's not happening everywhere, and people maybe don't know that they need to go to the doctor, or they don't have a way to get to the doctor, they don't have a car, they don't have gas money, whatever it is. So we need to be very aware of that. We need to be aware of pockets of people or whatever, that any clues that we can get that we can help other people fare better in this situation, we want to help out. And so and I say socioeconomic status, we also know that even over the Easter weekend, we see that different churches or whatever may be still gathered in person, and so we need to be aware of those pockets. And again, it's just to know the statistics, know what we're seeing, so that we can help prevent issues.
Yes, and Tom, that website is kdheks.gov.
All right. Yeah, absolutely. Okay, so let's see. Okay, Dr. Price from New York, a fan favorite. He is here because he doesn't ever have to wash his hair because he has none, and so he would rather just watch this video. So Mark, you are asking why we're not 6 feet apart. Actually, Destiny and I are very, very tiny people, and so we actually are 6 feet apart. You just can't tell because, the camera adds 10 pounds in height or subtracts.
Subtracts 3 feet.
Yes. So it's not us,
it's a very small screen.
It is. Oh, sorry.
We're as far away from each other as we can get
like
and be in the same screen.
All righty. Thank you. All right. So another question was about summer activities. Is Manhattan? Deb, you mentioned that Manhattan has canceled their summer activities, and have we talked about that here? Not as a whole. I don't know if the rec board is discussing that, and I don't believe the city has discussed it yet at this time. But and I know the schools are constantly discussing what's going to come next. But because we don't know what this is going to look like, we're kind of taking it on a couple of months at a time basis. So I would say that we don't know yet, but we are having those conversations to prepare for the next steps as we know more.
Yeah, I know. At least I have an inside track on Fredonia's rec commission, and they have not made a decision yet on what's going to happen with summer sports yet.
Alrighty, okay. So let's see. What was some other stuff? Oh, we talked. Man, we have a list. We're just rattling things off. This is some good stuff. Sorry. Yes, Joel, we've been on for 11 minutes. You know what? And it was the best 11 minutes that we've ever
You missed the good part.
Yeah.
You missed the good part.
We might as well log off now. Sorry. Okay. Alrighty. So some of the things, what about Sausage Fest, Toby? Our doctor in Washington, D.C. asked the most important question. Mm-hmm. At this point, it's still on, but that's late August, and again, we don't know. We don't know what that's going to look like. So.
We have to do it because it's my birthday weekend.
Oh, yeah. Then I guess,
and I it's my 40th birthday weekend, so...
Don't we look so good? I think that's what they're at home. They're either like, wow, they're 40, or else they're like, ooh, life has not been good to you guys. This pandemic.
What do
our
rough. T-shirts say?
Oh my gosh, how did we start without that?
I don't know.
It wasn't the best 11 minutes.
It wasn't.
Okay, our T-shirts today.
Okay, backwards. Stay vigilant, because it's a real word.
Do you want to explain that one?
So yeah, I accidentally said vigilant a couple weeks ago, and it's not a real word, but
it's a combo of
vigilant and diligent,
we could do the
which
whole
was
video
accidental. But Shelby, who made our shirts, found it online as a real word, so she says it's a real word. Now it is.
And mine says putting the woman in mandate, and that is just to say, all the cool words start with man. So I'm just claiming it for womanhood today. A little bit of this. We're gonna do the whole video this way. Is that okay? You can only hand puppets. Oh, never mind. Bad idea. Okay, so thank you for reminding us,
yes.
Kathy. My goodness. All right, so last time we talked about what is the expected peak in Kansas. And that's kind of been an ongoing conversation because even though the epidemiologists get their best guess, it still is, it's still a guess. It's an educated guess. And so, originally they were saying April 24th, and they're saying more like
maybe around the 29th. They're not really sure. It's all science guessing.
Sciencey guessing. That's the official term. Thank you very much.
Yeah.
So what we will say about that is you might be saying like, oh my gosh, the peak, it's going farther away. This is terrible. We're going to have to do this forever. The actual truth of it is that it's good. It's a good thing because that means that what we are doing is making it so that the cases that do come into Kansas or come into our communities come in slower. The whole thing about flattening the curve that you hear is that we don't want a huge peak, a huge spike of a whole bunch of cases all at once. In our entire county, we only have 40 beds. And so if we were to have a big onset of a lot of disease and all these people need to be hospitalized, we literally would have people in hallways or in different places that are not hospital rooms to try to accommodate them. We'd have people on ventilators when we don't normally have people on ventilators here. And so if you hear that and you hear about the peak and you hear about the possibility of extending the stay-home mandate, these are not bad things. Don't automatically think. But we get this at the same time. We know it sucks for everybody that everybody's just home. But it's a good thing because we're allowing the disease that we know will be here inevitably. We're allowing it to come in slowly so that we can handle each case, and everybody that has the disease can be tested. Everybody that needs to be hospitalized can be hospitalized, and we can do the things we need to do for every single person. So that's why we bring that up.
Yes, and yes, Londa, that is exactly what the peak means, the highest number of new cases per day. And like I said, right now, it's kind of going up and down.
We didn't
go through those numbers. Go for it.
Oh, okay. So our highest number so far was on April 8th. That was 148 new cases that day. And then after that, on the 9th, we had 58 new cases. Then on the 10th, 60 new cases. Then we jumped back up on the 11th, and that was 102 cases. But since then, the 12th was 69 cases, the 13th was 39 cases, and today we have 50 new cases that we know of.
Yeah, so, I'm not an epidemiologist.
You're not?
No, I'm not.
I don't know what I'm even doing hanging out with you.
But right now, we are keeping a pretty, kind of a wonky, it would be fine if it continued that way. Instead of, just and then shoot up, let's just keep it low, keep it steady, and then once because the numbers in the more metropolitan areas of the state are much, much higher than they are here. So that gives those places time to get those people well and get them out of the hospitals so that when we get it, we can send our patients up there where they do have more ventilators and more ICU beds and more of that kind of care where it won't stress our systems as much.
Yes. And they're equipped for that. We're not just saying we're going to shove people off to the bigger cities, but we should. Really, you don't necessarily want to be on a ventilator here. We will do it if you need to. But and so we know that things are happening kind of a little bit more seriously, I guess, or more new cases in the bigger cities like Kansas City and in Wichita. And so, but we rely on them every day for people with heart attacks and with strokes. And so that's where you normally send people anyways. And so it sounds weird to say we want to wait it out so that we can send people there. It's the truth. We need their help in this situation. Let's see. Oh, sorry. We kind of went up a little bit. Let's see.
That's a really good question, Londa. She asks, April 8th may have been the peak. How do we know? You only know by looking back.
Yes.
So odds are when the peak gets here, we won't even know it for several weeks because we're always looking back on the data. So there's no specific, we don't know how many the peak is going to be. And it could be the same number for 2 or 3 days, and that would still be kind of more of a plateau, but
we're not here for geography or topography. Is that a thing?
Typography.
Topography.
That's maps.
No, I know. And when they show the levels. We're not doing that one today. Okay, let's move on. Alrighty. Let's see. So welcome, Jason Wheeler. Keep it wonky. Yes, Kim Smith. We are constantly. If you have t-shirt recommendations, we are up for any suggestions you have. So let's talk a little bit about masks. Did someone say mask? I thought someone said mask.
I said masks.
Oh, I think you said masks. And our good friend Diane Height said masks also earlier on. So we do currently have what we're calling the Wilco Maskies Challenge, which we think is pretty cool because we said, hey, Wilson County, let's get all of our masks on because the CDC recommends that we wear cloth masks when we're out and about. And so, thanks, Dr. Hughes. She says, yes, it's topography. See, that's what you need PhDs for, is
there you
to
go.
Put that stuff out. Go. Okay. So, masks. We're doing the Wilco Maskies Challenge. And so we started that. We saw a huge number of maskies, which are selfies with masks. And so people in Wilson County are doing it. So you might notice that it's a little less awkward to go to the grocery store with your mask because you're not the only one wearing it. Hopefully that's the case. That's our goal because we want it to be the norm, and it's going to be the norm for a while. So, but then other counties have picked up on it too.
Yeah, they think it's really fun. And so they've accepted our challenge and they make their own little hashtag, and everyone's posting maskies.
Oh, yes. Like Dr. Gangula, who threw down the gauntlet today and said, watch out, buddy. So Montgomery County, I believe, is joining the mask challenge as well. So bring it, other counties. In the end, there is going to be a big winner, whoever has the biggest percentage, the highest percentage of maskies with our hashtag. But it really, in the end, we are all winners. Do you like how I turned that one around?
I like that.
Because when we all wear a mask, Destiny and I constantly say, give them the line. Why do we wear the masks, the cloth mask? Remember, it's not like that. Protector. Did you do that already today?
No, I didn't do that.
Oh, but you're so good at that one.
No, It's not you, it's me.
Yeah.
It's not you, it's me. It's not your droplets we're trying to keep out. It's mine. So
there we go.
Yeah.
I like it when Destiny says it. It's just very authoritative. But so the only way it helps is to slow the spread of COVID through asymptomatic carriers, because hopefully if you do have symptoms, then you're staying home anyways. And then if we are all keeping our own droplets in, then as a collective community, we are all protecting each other, right? So, so that's why it is important. So that's why we're really pushing people to do that, not because we want to. We really don't want to have to mandate something. Honestly, we want to do it because it's the right thing to do. And the CDC recommends it. Now the KDHE recommends it. So please, if you haven't already posted a maskie, go to our Facebook page or your own
Facebook page, yeah,
and just hashtag Wilco Maskies. Or your own counties, and then we will just have this great mask party, and we don't.
There's no prize.
No, there will be a prize. I haven't figured it out yet, though.
So far, so we're not sure what the prize is, but
it'll be great.
Prize.
You're gonna love it. Alrighty. Should we talk about restaurants? Maybe?
Sure.
Yeah.
So there has been in the legislature, there has been some contradictions, and we want to just clarify those. The governor, she put out Executive Order 2014. You guys don't have to remember these numbers. I just know them because I've read them so many times.
But there might be prizes if you remember.
Might be.
Just kidding, we don't have those prizes
We don't
either.
have those prizes either, no. So 2014 is the mass gathering mandate or order, where no gatherings over 10 people is basically it. There were some exceptions, churches being one. So she put out 2018 to change that, where churches would still fall underneath that executive order that didn't allow more than 10 at a gathering. Between those two things, she put out 2016, which is actually the stay-at-home order. So the stay-at-home order specifically states that restaurants can only do can specifically not do dine-in, and they can only do carry-out or delivery. So even though in the 2018 it says they can do dine-in, the 2016 trumps that, and they can't. So I know that's a lot of numbers and a lot of... It's a little confusing because one says we can, one says we can't. But the final word is 2016, and that's restaurants can only do carry out and delivery. I almost said dining.
That's okay. But there are so many good restaurants. We hope that you're also getting carry out or delivery, because we need to keep these businesses afloat as well. And so through this whole thing. So eat a lot. And then come to the doctor later, and we'll help you lose all that weight. Can I advertise like that?
Might as well.
It's a bad idea.
Everyone's talking about gaining the COVID-19, like the freshman 15.
Yes, the COVID-19.
Yep.
What about dine out and carry in? You can do it. Well, let's see, carry into your home.
Yes.
How about that?
There you go. And dine outside. At your home.
Amanda asked about, did Governor Kelly have the stay-at-home mandate until April 19th, and has that been extended? At this point, no.
Not yet. They are talking about it, though.
Yes. And I know individual places, like up in Kansas City, they're talking about it separately as like a metro area decision. But at this point, it's still only until the 19th, but the governor did come out and say the other day that they're talking about it, and they just don't have a decision yet. Oh, this is my sister-in-law, Rachel. Should we be wiping down carry-out containers after picking them up curbside, or is that just crazy? I will say that nothing is crazy at this point, right? Like, be extra careful. Be vigilant. Is this weird that I'm pointing like this?
Yeah. Be vigilant.
Be vigilant. And so, definitely, we talk about after you get groceries or whatever, wash them with soap and water. And again, you don't have to necessarily use bleach or antibacterial stuff because we're dealing with a virus. We need to break down the membranes of the virus, and that's what kills it. So you can use any soap, really. So soap and water for your vegetables, fruits, packages, like, if you get a salad, wipe off the outside, whatever, of the bag, unless you're making your own salad, which, am I just admitting that I don't make my own salads, like, from, bag salad? It's the way to go.
It's the way to go.
It's the way to go.
So much easier.
So if you do get carry-out food, give it a little wipe down. That's, in general, hopefully they are also doing that, but we have to just make sure that we are, we're taking care of ourselves. So wipe down whatever you can wipe down. All right. Okay. While we're looking at that, I wanted to address that. I know all over the state and all over the country, we have this whole new way that everybody is trying to teach their kids and keep our kids learning. And so just remember, please, that our teachers and our administrators are your first line. So if you're having any trouble at home, with the amount of work or anything, or if the kids are getting stressed, please, this is a stressful time for parents and for teachers and for the students, and we worry about everybody's mental health, and we know it's a thing. Again, we watch this and we see this, and so please reach out first to your teacher and your administrator. They are trying really, really hard, and they are there. They're available. They can set up individual Zoom meetings and things like that. So please don't be afraid. We want to do the best thing for our kids, and it's new for everybody. This is not something that we've done before. So.
No, and I've reached out to a couple teachers because it is kind of confusing, and they have all been really good about working with the kids on due dates. Like if they don't do something completely, the kid can kind of finish it up and turn it in if they missed an assignment or something, or a part of an assignment. So they've all worked with us really, really well, and it is not easy, but
we'll get through it.
Yeah. I just saw your front door.
I know, my
It caught me off guard.
So yeah, we're hoping that the messages we're going to help each other, and everybody understands that this is new. So we'll get through it together. This is our goal.
What would be the best way to eat and drink safely while at work wearing a mask? So,
and then she follows it up with,
obviously I know
that you need to remove the mask.
Needs to be removed. I'm kind of confused.
I think this actually leads into a really great discussion about exposure and and I think Cassie did a really great job of this in her update for today. So if you are from Wilson County, hopefully you've seen the daily updates. Cassie's doing a really great job with that. Every day we have new numbers and new updates from the state and the county and all that stuff. And so Cassie reminded us today that what exposure means.
Yes. Yeah. So exposure would be either being in close contact with someone who has COVID.
6 feet, but
6 feet, yeah, but closer than 6 feet, with someone who has COVID-19, who's coughing or carrying on and sneezing and spewing droplets everywhere. That would mainly be healthcare workers, or in some cases family household contacts, like if your spouse has it and you're sleeping in the same bed, that obviously would be contact. For the general person, it is within 6 feet for 10 minutes or more. So getting carry-out food, having a transaction at the grocery store, meeting someone on the sidewalk.
I think maybe being at work, just at your desk, as long as you're properly separated.
Yeah. And so, really try and keep that 6 feet in mind when you're around people. And then if you can't do that, that's when you would wear a mask, so that you would protect each other from droplets.
So do what you would normally do. Like if you're at your desk at work and you don't have people that are within 6 feet of you, and everybody's doing what they need to do, nobody's sick, nobody's coughing and sneezing, eat and drink like you normally would. And that's pretty much.
And I don't know if your question was how to take off the mask safely.
Safely while at work, while you're doing and then I know. So No, I think it was just about.
Was it just about? Yeah. So Katrina, if you want to clarify that, if we didn't answer your question, holler. But I mean, while we're talking about that, when you're taking off your mask, you really don't want to be like touching the outside. Oh, I just said.
And I also, while Destiny is reading that, I think, like, I never in my life thought that, like, donning and doffing was, like, a real thing that people would say a lot, and it's totally a thing.
They do.
But do you realize, like, I had to look it up, and it, like, was, like, Shakespearean, and it really is just adding the letter D to on and off. And I just don't, like, if that's all Shakespeare had to do, like, call me Shakespeare, but I will don and doff all day long.
Yeah.
Mm-hmm. So...
Yeah, so
Katrina's husband,
works at a factory, and he kind of goes all over the factory, and she's worried about him like taking a lid off of a thing. And my advice would be wash his hands first.
Mm-hmm. That's the biggest thing.
Yeah, have him wash his hands first, and then I mean, if it's a lid, so you're like opening it, so that area has not been necessarily exposed. He can wash the bottle while he's washing his hands with soap if he wants, if he's like had it sitting around all over the place, but that would be, in my opinion, one of the safer ways to do it.
And then, Mary, you asked, would we suggest wearing the same mask all day? So yes, I would say yes, unless you come, like if you get into close contact with somebody who's coughing or sneezing or whatever, or if it gets wet, or if it gets soiled for any reason, so that would be when you would change it. And we do recommend those cloth masks, so if you can wash them every day, change them out and use a different mask each day if possible.
Yeah, and most of us, we're only wearing them when we go into the grocery store or when we go into the hardware store or Dollar General or wherever we're going into. So it's not like you're wearing it all day long. Even in our office, we're not wearing them all day long unless we're all sitting in the same room. So if you're only going to go to the store and go home, you don't have to wear it at home.
And you could put it in like a Ziploc baggie even, just to kind of like keep it away from other things, just. And again, and just like Destiny said, you probably aren't wearing it a whole lot.
Yeah.
Unless you're my daughter. Like, she wears hers all day, but I think she's whispering things that I'm not supposed to hear.
I wore one to the grocery store today, and I literally took it off and threw it on my seat in my car, and then I'll go home and throw it in the washer tonight, and I'll take it back to work tomorrow.
And we will say that people are asking a lot about masks that we're using in our clinics and in the hospital. First of all, everyone is wonderful. When they find that they have resources that could be useful, they offer, to the hospitals and to the clinics and to the health department. So thank you guys. We really appreciate it for you thinking about us. So we are using, you might notice that we're using masks kind of all day, one mask all day, which we would have never done that before, but it's a new world we're living in. We have to preserve our protective equipment as much as possible. So just in case you see us wearing the same mask, we tend to leave them on for for the day or when we're seeing patients, and then we do carefully take them off and throw them away or whatever at the end of the day. So thank you. And we've got these, like we talked about, like mask fashion. That could be a thing. It's not a thing. Destiny says no. But mask fashion last week, and like the little hair thingies, the headbands that preserve your ears because they have the buttons. I mean, there's so many great things that people are offering. So thank you guys. A lot of talented people out there, and it's a whole new. I mean, we might keep wearing these after the pandemic. They could be very trendy. Could be the new thing.
They could be. They fog up my glasses, though.
Never mind, they won't be the new thing.
So use paper bags so the mask can dry out and not grow any cooties. Great advice.
Right.
That's good. Don't microwave your masks.
Don't microwave.
If they're not 100% cotton, they will burn up in your microwave.
Don't use plastic bags because people will suffocate. Okay, don't do that. Alrighty, other questions. What else do you have on yours?
I don't have anything else on my really.
We don't.
No, never mind. We already did it.
Yes.
Yeah. So we'll go over.
Yes.
Yeah. See, I made a note. We'll go over some terms because I think it's really important that we all kind of speak the same language. So I know a lot of people are saying that they're in quarantine right now, like this whole thing is quarantine. It's not. It's not quarantine.
Right.
Quarantine is very strict. You can't leave your house, and we put people in quarantine that don't have symptoms but have been exposed to COVID-19, or we think have been exposed to COVID-19. So that is quarantine. Isolation is when you are sick and you have to stay home. So if you are sick and you're tested for COVID-19, you're in isolation until your test comes back. And if it comes back positive, then you remain in isolation until you've recovered. If you test positive, then you are a positive case. Presumptive positive was a thing at the very beginning of this when the states were just learning how to do the testing. They would have to test someone, and if the test came back positive, they were a presumptive positive. They were a presumptive positive, and the test had to be verified by CDC before they were a technical positive. So right now we're not having to do all of that. So presumptive positive isn't even necessarily a thing. We do have what we call suspect cases. We don't have any right now. That would be more when community spread starts and you have people that have symptoms and you have linked them epidemiologically to a confirmed case, then they would be a suspect case and wouldn't necessarily be tested, or a probable case, and they wouldn't necessarily be tested, but they would still be in isolation. They would still be home.
Wait,
so
quarantine or isolation? Do they
isolation.
Have okay,
they would have
symptoms.
Okay. Yeah, if they have symptoms. The easiest way to remember quarantine and isolation is ill people, and quarantine is just exposed people. And all of this stay home stuff that everyone's in, it's not
quarantine.
It's not quarantine. It's social distancing. It's just really
not fun.
Yeah, I was gonna say really extreme social distancing, but it is. It's extreme social distancing
for a reason, for a good reason. I think this brings up a lot of stuff, and we have some good questions that came up in there. First of all, I have to acknowledge that Dr. Seth Fox says that he knows what donning and doffing is. I mean, I've always thought of Seth as a Shakespeare anyways. Mm-hmm. You know, a man
very wordy.
Very wordy. We can't shut him up, ever. And I think we'll talk about
that later.
So testing, people are asking also, are we actually testing? We have all these negatives and all that. Great question. I mean, ask us whatever. We'll answer it. Everybody who's coming into our clinics, if we suspect them of having COVID, like they have the symptoms and they have some sort of something that like a travel history or something, or exposure history, we are testing them. We have ample tests in Wilson County, and so we are currently testing them. There are none of them that we say, well, you probably have it. Go home, isolate yourself for 14 days, and we'll keep checking in with you. They are doing that in some places, especially where the testing is limited. But in Wilson County right now, we are testing everybody that we suspect of COVID. Now, if you come in and you say, I have no symptoms, I have no reason to believe that I have COVID, but I just want to be tested, you will not be tested. We are not testing people without symptoms at this time. Mm-hmm. So even if you were exposed to somebody and you have no symptoms,
then you're just going to quarantine until you develop symptoms. And if you develop symptoms, then you will be tested.
Awesome. Let's see. Do you want to do... going back on masks, somebody asked about... They said they read that cloth masks weren't very helpful and they have to be certain masks. There should be certain masks for healthcare providers because we are coming into contact with people, and N95 masks are the ones that will protect us as healthcare providers from other people's droplets. Those are the only kind, of the masks that we're wearing that will protect us from other people's droplets. Everything else, cloth mask, everything else, they are fine. I mean, it's definitely go ahead and wear those cloth masks, and they will protect other people from your droplets, but they will not protect the wearer from other people's droplets. So just to review that one. And then there was a question about gloves. There is no recommendation on gloves at this point. It's more recommendations on hand washing. So like, let's say you wear your gloves to the grocery store, you're touching everything just the same.
And then you get in your wallet, so then you've touched everything to everything's on your gloves. And like Jennifer said it before, and it was perfect, your gloves are only as clean as the last thing you touched. So if you're going through the whole grocery store and you are touching all of the items that you're putting in your cart, and you touch the door to come in, and you touch all those different things, and then you reach into your purse, you've just like contaminated everything in your purse as well. So it really doesn't make a lot of difference. I guess the only time it would really make much difference at all would be if you were to put your gloves on at the checkout to reach into your purse
and then take
your gloves off before you
but don't do that.
Put your stuff back. But I mean, it really does. It's called cross contamination. It really doesn't help necessarily.
Alrighty. I'll address that one in a second there. Let's see. Train your hands, yeah. I mean, yes, don't touch your face also. So
yeah, I caught
absolutely
myself touching my face a lot in the last video. My nose is so itchy from allergies.
I know. And allergies are a thing. There's still a lot of stuff out there. Allergies, sinus infections, strep throat, influenza, we're not seeing as much, but it's still possible. Like other types of respiratory infections like rhinovirus and parainfluenza, like old coronavirus. Like, man, what I wouldn't do for an old case of coronavirus at this point. Like, a weird statement, but whatever, we'll go with it. Oh, sorry, I don't know if I missed anything there.
I don't.
Testing we covered. Oh, do you want to do Neo-Deshay?
Yeah, so Neo-Deshay Sonic. We've gotten a lot of questions about that, and I want to, someone just asked about it a few minutes ago. So Neo-Deshay Sonic was not required to shut down. They did that out of an abundance of caution on their part, and it was to clean their stuff. One of their staff was a contact of a COVID-19 case, a confirmed COVID-19 case in a different county. That staff member is quarantined.
No symptoms at this point.
No symptoms at this point. We are now calling and checking on him, not every day, but like every other day. So they plan to reopen Neo-Deshay Sonic. That's what they've told us. They plan to reopen, and yeah, that's their plan. They just wanted to get it good and clean and make sure that they weren't contributing to any spread. So, I mean, they were just being extra cautious.
And we thank them for that. Like,
yes,
they didn't
very
have to
much.
do that.
No.
And he's still, like, the person, or the ones that we're monitoring, are a contact of a confirmed, not somebody who has any symptoms or is being tested or anything.
They are not a confirmed case of COVID-19.
So let's hope. Let's, hope that it stays that way and all is well in Wilson County.
Yeah.
Somebody asked about, I posted earlier about a doctor friend of mine that was intubated. So he's a little bit older than me, so that makes him 29. I'm just kidding. So a doctor friend of mine, the reason I think that story was important is because he's probably mid-40s and out there taking care of people, and this kind of thing, it's even though we talk about the most vulnerable populations, older people, chronic diseases, it is still affecting younger people and people who are healthy otherwise. And so it was near and dear to my heart to have a colleague of mine have the disease, and then also he ended up being intubated. So he is doing well, and so we expect him to recover nicely. So thank you for asking on that one. But yes, it's a real thing, and we hope that we don't have to experience things like that here, but we know that's a reality.
You want to answer that one?
Sure. How effective are the wipes at the front door of grocery stores, using them as we gather our groceries? So I don't know if they are as effective in the gathering of groceries. Like, what I would probably say is use the wipes to wipe down your grocery cart, and make sure that any germs that were on there before you got there are wiped off. Do all your grocery shopping, do what you normally would do, and then when you go home, wash your hands really well, wash the things, that you bought, kind of like we mentioned earlier, just to wash them all down. But it would be really hard to I think, wipe everything down as you went along. So don't touch your face, don't touch your mouth, don't touch anything else until you get home, wash your hands, wash everything, and then that's usually what I would recommend.
I usually take one and like wipe my hands with it when I walk in the door, and then I put it in my pocket, and then it's still wet. I mean, I usually go grab like 2 things because I'm not going very often. So I go, and then as I'm checking out, like I'll like use it to push the buttons on the debit card machine, so that all those places where the same people have been touching, I'm using the little wipe to do that. And they haven't yelled at me yet.
That Destiny, you gotta watch her. She's just like grabs it, sticks it in her little pocket.
I use the same one twice.
I'm just joking. That's some good advice right there. See, we're coming up with some good stuff right here, right before your eyes. This is where the magic happens. It's magical.
Oh my.
Alrighty. So let's see. I don't think there's any new ones yet. And again, we appreciate everybody that genius. Thanks, Karen. We appreciate the people that hop in to ask questions and to just listen in, because we just want to be helpful, because we know this is a scary time for everybody, and we know we make a lot of probably just weird comments. I'm not convinced they're funny, because we're the only ones laughing. Yeah. That's all we can hear. But we know that it's a scary time for people, and we just want to inform you and be a resource for you. There's so much information out there. What do we believe? What do we not believe? What station do we watch? What thing online do we read? And it's hard to know. And so it's not that we definitely know everything by any means. But
no one does. This is a brand new virus, and
we're here to gather information, and we'll give you the things that we do know, and we'll admit the things that we don't know. And then every step of the way, we're going to help walk through it. Like this. Shove the wipies in your pocket. Like, that's genius. It really is. So we'll work through that together, and so that we can all feel better about a time that it's hard to feel okay, and know. So that's what we're here for. That's our main thing. I will say, I think I want to give a shout out to Lacey, our nurse practitioner, because she sent some very thoughtful words, and I think one of the most important things to remember is the things that we're doing now, and we mentioned it earlier, but the things that we're doing now are important, not only now and for flattening the curve and everything that we keep talking about, keeping coronavirus out of Wilson County, that kind of stuff. I mean, that's great, and that's immediately exactly what we want to do. But in the long run, this is a new world. We're all going to come out of this a little differently, and we hope that it's in a better way, that we are going to be more aware of touching our faces, of washing our hands, of how disease is spread, how we can protect each other simply by staying home. And so the things we're doing now will continue to help us later on, because we're in it for the long haul. This is not going to go away even after the peak, or even after a couple of months from now. Even we're still going to see some days where it'll spike up again, and oh my goodness, there were a few cases in this county all of a sudden, and that will be scary for us again, and we'll wonder if it's going to surge back up. But we're doing the things now to make that our new habit and our new world, to protect each other now and a year from now, because we don't know. Pandemics, they come out of nowhere. I mean, and so we don't know what the next thing is, but we use all this information, all this experience now to continue to protect each other.
Yeah.
So thank you, Lacey, for pointing that out.
Yeah, I don't know about any of you guys, but I can't hardly watch a movie anymore because they touch each other so much in movies. Like, they
do
hug
not
each other.
Face Off. First of all, that's a weird movie. I mean, like Nicolas Cage. Sorry, Nick Cage, but you kind of creep me out some days.
But yeah, every movie I watch, I'm like, those people are standing way too close together. Yeah, those people are touching each other.
Yes, I know. It's a thing. Alrighty. That's a good question.
Yes. Okay, Charlotte. Why don't KDHE numbers ever go down? Aren't people recovering or unfortunately passing away? Yes. So the numbers that KDHE are giving out are cumulative numbers. So they aren't reporting yet the number of recovered cases. They are reporting the number of deaths every day. So we have asked them about. We've asked them about that, and they're trying to figure out the best way to collect that data. And we've asked them about it a few times, and they're doing a really good job of whenever we say we want something or need it, that they are actually listening and they're doing it. And so I really think that data is forthcoming. I don't know if you were on here at the very beginning, Charlotte, and because we talked about it just a little bit, and I reached out to some. I'm going to say it again because I reached out to some of my partners in the region, my health department administrative partners, and they're cumulatively there are 48 cases reported in the area of Southeast Kansas, the folks I reached out to, and 24 of those have actually recovered. Unfortunately, 3 of them have died, but so the number, the 48 that the state's putting out, that's how many cases we have, how many cases we've had cumulatively. Those cases don't go away. They just have to start reporting the recovery numbers.
Yeah, all right. Hopefully that answers your question. That's great. All righty. Poor Charlotte's still at work. That's all right. We won't tell. So also, yes, Diane, a really great point. Please do not spray Kevin Steele, the mailman, with Lysol. He's just trying to do his job. And I think he's doing a good job with good hygiene. Thanks, Diane. If you ever thought about quitting smoking, now is the time to do it. There are studies that show that people who smoke right now
and
vape, oh yes, and vape, have worse outcomes if you do catch coronavirus. So again, we are ready to help you quit. We have all kinds of drugs to give you that are legal drugs, prescription drugs.
Yep.
I must clarify. This is the interweb. All righty.
Connie, I saw your question about the stay-at-home mandate. Yes, I think they haven't extended it yet, but they are talking about it. So.
Okay. Well, we're going to do our last call. This is about that time, right?
Yeah, I think so.
We don't know. We can't actually see a clock so we just keep talking until we stop talking. We just actually, people don't see it. Once I hit the stop button, we just pass out for a while, and then someone has to kick us and get us up. There are a lot of great things happening in Wilson County and all over the state and all over the country. The food resources are amazing here in Wilson County, all over the place. They're serving so many different meals. So if you know anybody who needs help, please reach out to the health department, reach out to the schools, reach out to the food banks. There are people that will get them hooked up. Our hospitals are prepared. That was one question last time. Are we prepared for when it gets here? And absolutely, every person that we test. And how many have we tested so far? I can't remember now.
58.
So every person we test, we treat as though they do have coronavirus. And so we go through every step of how to appropriately swab, putting them in the right room if they are hospitalized, that kind of stuff. So we're preparing every time. We're having discussions with other hospitals that have ICU beds to prepare for if we do need ICU beds, where do they go? And so we have those preparations already, knowing what the plan is, and they're ready to take our patients. And so the churches are doing an amazing job. Almost every church in Wilson County avoided an in-person service. And the amazing thing that we heard, Destiny and I heard, and hopefully you guys heard it too, is that one church said normally they have about 200 people at their service. And because they did it online and did it in a different way, they had over 500 people that viewed their services.
Yeah.
So things can happen, and things can happen in such a beautiful and great way, even though it's not the traditional way. So as we find our world to be different, let's continue to find ways to do the things that are important to us, and not feel like we need to sacrifice those values and those things that we hold dear. So our churches, our businesses, our different organizations, our volunteers, our individuals, our county is amazing. We are super proud. I mean,
yeah, you guys
we're super stinking proud.
You guys are kicking butts.
Yeah. That's the edited version.
Yeah, well, we're on TV. Oh, no, we're not on TV, but we are on YouTube now.
Oh, we
are YouTubers.
Yes.
Yeah, so if
like
you,
the kids.
Yeah, I thought maybe my kids would think I was cool, but they still don't. No. But we are on YouTube. If you go to YouTube and Google Wilson County, Kansas, the Wilson County Health Department has a page now, or a channel, or whatever they're called.
Whatever the
and so if anyone wants to watch these videos on a loop, like over and over, you can.
It keeps coronavirus away.
Like my mom doesn't have Facebook, so she watches them on YouTube. So anyone who doesn't have Facebook can watch them. They just have to go to YouTube.
Oh, we should share the link.
I did on my page when I shared it, but we'll put it in the share it again.
All right, awesome. We're so high tech these days.
It only took me 2.5 days to figure it out.
No, now we have to figure out TikTok.
No TikTok.
Brooke just said it. Oh, see, no. TikTok. That's the thing for the kids.
TikTok for me.
All right, you guys. If there are no other questions, then we will be back here next Tuesday and every Tuesday for the foreseeable future at 5:30. And if you have questions, please keep them coming. People have been really great about asking questions.
Yeah, they really, really have.
All right.
All right.
Okay. Love you. Love you all. Bye-bye.
Bye-bye.